Welcome to the FDA's History Vault, containing more than 10,000 items from FDA's history.
Today's episode, Radiating Shoe Sales. In the late 1890s, scientists discovered radiographic imaging, or X-rays. This remarkable scientific discovery allowed doctors to see inside the human body without invasive surgery. But, as with most cutting-edge science, it also inspired uses of variable therapeutic value. During the First World War, thousands of soldiers were afflicted with trench foot, and many more developed chronic foot problems from poor-fitting military boots. The military developed a science of shoe fitting, which was embraced by podiatrists, osteopaths, and shoe retailers. Boston physician Dr. Jacob Lowe used the science to invent and patent a device that allowed him to see moving X-rays of his patients' feet without having to remove their boots.
In 1927, Lowe sold his patent to the Adrian X-ray Company of Milwaukee, which led to the use in shoe stores of this device, the shoe-fitting fluoroscope, which was marketed as a scientific method for optimizing shoe fit. This particular model is part of the FDA history collection and is on display at the White Oak campus.
The marketing focus quickly shifted from veterans to young children and their mothers, who were anxious about their children's healthy growth. Shoe salesmen used the fluoroscopic technology to suggest, misleadingly, that they had orthopedic expertise. The marketing worked. By the 1940s, there were at least 10,000 fluoroscopes in shoe stores across the United States. Unfortunately, the machines not only didn't do what they promised, they exposed children, their parents, and store clerks to unhealthy doses of radiation.
The device typically consisted of a large wooden cabinet with an X-ray tube at the base, and just a few inches above that, a cutout window where the customer would place their feet, virtually right on top of the X-ray device. There were also 3 viewing scopes, one for the child, the mother, and the shoe salesman, where they would see a green outlined hue of the X-ray of child's feet. The design of the device allowed for a large degree of radiation leakage, starting at the foot area, coming up to about the pelvic area, and going out up to 10 feet from the device.
In the 1940s, scientists and regulators began to raise serious concerns about the shockingly high levels of radiation emitted by the fluoroscopes and the risk posed to children and clerks. Mounting professional opposition led to changes in laws. As of 1970, a total of 50 states had taken some form of legislative action against the device.
The FDA never was able to take action against manufacturers of the shoe-fitting fluoroscope because at the time it didn't have regulatory authority over radiation-emitting devices. However, by the early 1970s, concerns about radiation were being raised about appliances like televisions and microwave ovens, and by 1971, FDA was given authority over radiation-emitting devices.
Today, the regulation of radiation-emitting products is delegated to FDA's Center for Devices and Radiological Health, which not only protects consumers from harmful novelty devices like the shoe-fitting fluoroscope, but also sets standards for medical imaging, as well as surgical and therapeutic equipment, security systems, and consumer products. We hope you have enjoyed your visit to the Vault.